preemie babies are just at higher risk for developing vision and strabismus problems. So what is it that I am looking for after your baby's been discharged from the NICU? Why is it even important to keep these follow-up appointments with me? And what are good questions that you can ask your pediatric ophthalmologist at these visits to ensure that your baby is progressing and developing visually? Even if your baby was discharged from the hospital, if the retina is not fully mature, that means we still have to continue follow-up even as an outpatient. And at the 6-month mark, we're doing a lot of different checks that your pediatrician is not doing in such great detail to make sure that your baby is on the path for good vision. So the other day, I was doing my retinopathy prematurity clinic in the hospital, and I have an outpatient clinic there where I see the babies that have been discharged from the neonatal intensive care unit, and they will often see me as well as see their neonatologist or the nutritionist to make sure they're getting enough calories. And I walked in the exam room, and the parents looked at me extremely confused. Now, there are a bunch of ophthalmologists that will do rounds. Typically, there were 4 of us at our hospital. And so I don't always see parents that I had seen in the hospital. Sometimes there's a retina specialist who also takes rounds, and he will see the babies in the neonatal intensive care unit, and then I'll see them for follow-up. And these parents were new to me, and they were super confused. Like slightly agitated, but they really just were like, why are we here? Why do we need to go through this eye exam again? And for so many parents, it's really traumatizing. There's so many different types of appointments, especially when you're out of the hospital. It's almost easier when you're in the NICU because all the specialists come to you. But now you have to bring your baby to go see the neonatologist and now the ophthalmologist, which these parents were kind of confused about and weren't really expecting. So what is it that I am looking for after your baby's been discharged from the NICU? Why is it even important to keep these follow-up appointments with me? And what are good questions that you can ask your pediatric ophthalmologist at these visits to ensure that your baby is progressing and developing visually? Hi, everyone. I'm Dr. Rupa Wong. I'm a board-certified pediatric ophthalmologist, and I have been examining babies for 18 years now, which is a long time. And I've always done retinopathy prematurity exams. I've always taken care of preemie babies. It's something I truly enjoy. And it can be a very difficult time for a lot of parents. I completely understand. As a mom of 3 kids, it's something that my heart goes out to, just the amount of trauma that goes with having a premature baby, but also just the amazingness because they are so resilient. So you bring your baby home from the NICU, your baby is thriving, they're eating well, they're starting to meet their milestones, they are catching up and meeting everything that they should. And then you get a phone call like, oh, you've got an eye clinic appointment. You need to be here at this time. Maybe depending on the eye clinic, maybe you need to go pick up some eye drops and they want you to put the eye drops in. It seems confusing because you thought you were done with it. They had their eye exams done in the NICU and maybe you figured that's it. That's all you need to get done. And maybe even when the ophthalmologist saw your baby in the NICU, they told you everything was fine. So doesn't that mean you don't need to see your baby anymore? Well, there's a couple different follow-up appointments that we need to do. And it's important to just ensure that your baby's vision is developing fine. So first, even if your baby was discharged from the hospital, if the retina is not fully mature, and if you haven't listened to, you can go ahead and listen to my episode on retinopathy of prematurity. If the ophthalmologist did not say, yep, the retina is fully mature, meaning like all the blood vessels have grown out to the periphery, you're good, that means we still have to continue follow-up even as an outpatient. We still have to watch and record these blood vessels. Everything might be fine and we don't see any abnormal blood vessels, but I still need to watch them until they grow out. So you might have visits as soon as you're discharged, within a week, and we have to keep watching until the blood vessels are fully mature. Now, let's say I came and I saw you, or your ophthalmologist came and saw you in the NICU and they said, yep, everything is fine, mature vascularization. That always feels like the baby is graduating. I love it. I love being able to write that on the chart, mature vascularization. I put a little smiley face on it too. And it just feels like a milestone. You don't need to come right away, but you still need to see me in 6 months. And the reason for that is even with just any premature baby, even if they did not have retinopathy premature, if they didn't even have those abnormal blood vessels or they didn't need laser treatment, which of course, if they had those or they needed a VEGF treatment, anti-VEGF treatment, or a laser treatment, then you absolutely need to be maintaining closer follow-up with me. But let's say everything was good, you still need to come in 6 months. And the reason is preemie babies are just at higher risk for developing vision and strabismus problems. That's just been shown. And at the 6 month mark, we're doing a lot of different checks that your pediatrician is not doing in such great detail to make sure that your baby is on the path for good vision, because that's of course what we all want. So even full-term babies, their visual system is not fully developed. It takes time for the visual system to develop in a baby up until about age 2. You've always heard, oh, initially a baby's like 20/800, or they can only see black and white shapes. And I've got a full podcast episode on the exact milestones that babies see. But even term babies born at 38 or 40 weeks, their visual system is still developing. And then added onto that a layer of prematurity, a little bit further behind in terms of the visual development. So this is something that we really just want to make sure that things are hitting where they need to. So the few problems that we're worried about: farsightedness or hyperopia, strabismus, which is misalignment of the eyes, and amblyopia. That's when the vision in one eye is worse than the vision in the other. And like, how can you tell that what a baby's vision is? We do all these measurements, and that's why you've got to come in at the 6 month mark. This is different than what the pediatrician can check. Obviously, the pediatrician cannot tell you what your baby's vision is at 6 months, but we're looking for certain things, and that's what I want to review now so that you feel comfortable. All right, this appointment is necessary, and then also are armed with the questions that you can ask your ophthalmologist. Probably you're seeing a pediatric ophthalmologist to make sure that everything is going in the right direction. So one of the first things that I am checking for is something called delayed visual maturation. I tell parents, it's not like the vision is a light switch where all of a sudden, whoop, the vision just turns on and everything is good to go. It's more like a dimmer. It takes time to develop. Like I said, even for babies that are born full term, it takes time. And we just want to make sure that that progression is where it needs to be. But this is really the most common diagnosis that I see in premature babies. It just means that the vision is just lagging behind just a little bit. And likely your pediatrician is telling you as well that the developmental milestones, the other milestones that you're watching for your baby, just a little bit behind. Usually they say by about age 2 that preemie babies have caught up to where they need to be. And it's kind of the same thing with the vision, but it doesn't take till age 2. Usually we're going to see in babies that they're starting to fix and follow. They're starting to watch and track objects and faces around that 3 to 6 month mark. But for preemie babies, again, that's going to be a little bit further behind. So what I'm looking for is I'm just checking to make sure the pupils are a normal size, that the pupils themselves, the black circles in the middle of the eye, react normally to light. And when I can check that, then we're also checking a lot of different other things. We need to make sure that your baby's able to track objects. That might be a concern for you. You might come home and think everything looked fine, but there's not looking at my face. Is that a problem? Is that something to worry about? And more often than not, it's not something to worry about. Your baby will catch up. This is that dimmer switch we're talking about. It's gradually every day as they receive more and more sensory input, things are going to improve. But it's something we need to watch. Really, it's just that the brain hasn't fully connected to the eyes. And just like they're learning to use their arms and their legs, they're learning to use their eye muscles and even their visual input. So for full-term babies, around 3 to 6 months, they're starting to track objects. You can show them a little thing, they'll track it. And then when you bring your baby home, you might not see that, and it can be concerning. This is just really more of a neurologic processing. We just need a little bit of extra time for your preemie baby to make those connections between the brain and the optic nerve pathways. That immaturity is just normal for premature babies, and it's not anything to be concerned about, but it follows a time course of its own, and that's something that we're watching out for. Now, most full-term babies, maybe 3 to 4 months is when you would see them track objects. So a premature baby adjusted age, remember this is adjusted age, usually we're going to see it at 3 to 6 months adjusted age. So not 3 to 6 months post-gestational age, but the adjusted age. So that's something also to be mindful of. You got to always look at what the adjusted age is for your baby and track those visual milestones the same way that you would track any other milestone that you're watching. Now, a lot of times it might seem like all of a sudden they respond. And one day they aren't seeing things, and then another they're actually tracking stimuli. And that can also be normal. That dimmer switch can get thrown on real quick. And there's nothing that you need to do. There's no eye exercises. You don't need to show them black and white objects. Just life in general, that visual input is enough. There's no glasses or surgery or medications, eye drops, or certain kinds of food or formula that you need. You just need to give it time, which can be hard. I'm not a patient person, but eventually the majority of these babies are going to develop normal visual responses. It just takes a couple months longer. So if your NICU baby is not engaging in a way that you think is normal or you're concerned, of course, let us know. And we can check to make sure that there's not anything else going on the inside of the eye. Now, the eye exam I do in the office at that 6-month mark, it is nothing like what I have to do when a baby is in the NICU. I do not need to put that lid speculum in the eye to keep the eyelid open because we don't need to check the periphery. I don't need to move the eyeball around with the little cotton tip applicator, the little Q-tip, or with the metal scleral depressor. So you don't have to worry about that. Usually at the 6-month mark, I just need to get a quick, brief look at the middle of the eye because we've already examined the eye very fully and in its entirety. And once the blood vessels are mature, you cannot get ROP again. Once they're mature, that's it. They're not going to ungrow. So you don't need to worry about that. I know it's a really common concern for parents. But what we're also then checking for is just to make sure that there's not something else going on. It's possible to have two things. So we do want to dilate the eyes and check the inside of the eye to make sure there's not a tumor or something else that has grown in that 6-month period. So what else am I looking for at that 6-month exam? Well, first, I'm checking the pupils, as I mentioned. Then I'm looking at the alignment. Preemie babies have a higher chance of having crossed eyes or wandering eyes. So I am checking to see if the eyes are straight. At 6 months post-gestational, they should be relatively straight. If they are crossed in or wandering out, then we're going to have a discussion about treatment for that. Glasses or even sometimes more advanced if we need to do surgery. And then I'm also checking, once we put the dilating drops in, I'm checking the refractive error, which is what is a refractive error? That's basically what is the glasses prescription? Because again, preemie babies have a higher chance, especially if they were treated with laser, they're going to be more likely to be nearsighted. Sometimes they're more farsighted. They can even have astigmatism. A normal amount of farsightedness, that's fine because all babies are farsighted. But if they have a high amount of farsightedness, that's something we might need to give glasses for, or even astigmatism. And I smile because I think that babies in glasses are so cute. They're so adorable with those little Harry Potter glasses, especially when they come in all the different colors. But it's nothing to be concerned about, and it's something that we can provide. They make babies glasses that are so comfortable for babies' faces and their nose bridges. So that's something I'm checking. I'll put the dilating drops in. I use a thing called a retinoscope. I use different lenses, and I can check to see, are they nearsighted, farsighted, or have astigmatism? And then I put that indirect ophthalmoscope, that thing back on my head, and use the lens to really get a quick look at the inside of the eye, just to ensure that nothing else is going on. Now, this exam you might just bring back all those terrible memories of being in the NICU, but the exam itself is going to take about anywhere from about 45 minutes to an hour. And that's just because those dilating drops take so long to take effect. And when you come in to the office at the 6-month mark, we're putting it in, or my assistants are putting them in, and they take so long to take effect. But usually the actual exam itself, the brightness, the lights, that's not that long. And it's going to give us so much good information. It's also just going to allow you to rest easy and sleep easy, to know that everything is good. You know, there's not anything going on in the eyes. They don't need glasses. Their eye muscles are tracking. There's a normal amount too of misalignment of the eyes, which is very common in full-term babies as well, because like they're learning to use their arms and legs, they're learning to use their muscles, and they can be kind of uncoordinated. But again, at that 6-month mark, we really should not be seeing any eye crossing. And if we are, sometimes it just means they're farsighted. Sometimes it might mean that we need to do surgery. And that's a discussion to have with your pediatric ophthalmologist. But I will say, out of the hundreds of premature babies that I've treated, I've never had to do maybe just one eye muscle surgery on a preemie baby. It's really not that common, but we want to be sure. We don't want to miss anything, because having crossed eyes is not just a cosmetic thing. It's actually going to affect the development of the visual system. And we want to give your baby every chance to see in 3D and with depth perception. So that's why we need to correct those things as soon as we see them. And just know, even if you are concerned, even if you're worried about the tracking and the development of the visual system, there have been so many studies that have shown this is a really common delay in preemie babies. So you're not alone. If you've got NICU parent groups that you're still in contact with, likely the same thing is happening to their babies. But it is 100% something you want to maintain that follow-up exam and not just write it off as being, oh, it's just delayed visual maturation. We don't need to worry about it. Because sometimes it's something a little bit more where we do need to get involved treatment-wise. Essentially, the earlier we begin any kind of treatment, yes, even at 6 months, like a patch or glasses or even surgery, the better it is for the development of the visual system. And then that actually helps meeting the other milestones. If the babies can see well, then they're going to be able to pick up those Cheerios. They're going to be able to crawl. They're going to be able to walk faster at those appropriate milestones. If that's delayed, it can affect, of course, the rest of the development as well. Last part, what are questions to ask your eye doctor? Hopefully, if you have a preemie baby, again, you're seeing a pediatric ophthalmologist, because this is really within our scope to handle the complexity that comes with premature babies and just the medical conditions. And we're really looking out for things. But I know there are a lot of areas in the United States and in the world that don't have pediatric ophthalmologists readily available, or they're the next state over. And so if you are seeing just a general ophthalmologist, these are good questions to ask just to ensure that everything's being done the way that they should be. So these are a few questions that I recommend every NICU parent ask their eye doctor. Again, just to give you a little bit of sense of control and just to feel educated and empowered with what is going on with your child. So if your baby's under 12 months, if this is the first visit after the NICU, ask, is my baby's vision tracking to where it should be for their age? This is going to help identify visual maturation and any need for follow-up or need for intervention. Are my baby's eyes aligned? Are they straight? Or is there any eye crossing or drifting that we need to worry about? Sometimes it's difficult to see as a parent. And a lot of times, I'd actually say the opposite is true. A lot of times parents think the eyes are crossing, and really it's just, we see a very wide nasal bridge and it's a false appearance of crossing, but it's always better for the ophthalmologist to make that determination and not you. So don't feel any kind of guilt if you've missed misalignment of your eyes. It is hard. It is hard to examine in a baby. I've been doing this for almost 20 years and it's still hard. And usually I have to have another assistant, with little toys and things like that to really get the baby's attention. So that's not anything that I want people to feel like, oh, I missed this. There's a lot going on. You guys are handling so much that this is something that we're trained to do. And it's a great question to ask your ophthalmologist. Does my baby need glasses now or in the future? When I do my retinoscopy, I get a number. And I can kind of sense usually, oh, this is good. They're right on track with all the other babies their age. They're not going to need glasses. Or, yep, they're looking like eventually they might be a little bit nearsighted or they've got some astigmatism. So ask that question. There are no dumb questions. And a lot of times might not have anything to do with your baby's prematurity, but might be more related to the fact that your genes, whether you're nearsighted, farsighted, or have astigmatism. Are there any signs of amblyopia or lazy eye? This is really important. And when I check the retinoscopy, I'm checking to see if there's asymmetry between the two eyes. I'm also checking that alignment. So if one eye seems that it's lazy, and I really do hate that word, but it is what most people use. So I'm going to use that word right now. If the eye doesn't seem to be seeing as well as the other eye, then patching treatment can be started even at age 6 months. How often should we follow up? Usually if there's no issues, if we see you at the 6-month mark, then we typically don't need to see you for another 6 months to a year, unless we see something concerning. What should I be watching at home? Simple things like, are they making eye contact when they should be? Are they responding to faces? Faces always draw attention initially. Are they starting to engage in that way? Those are really easy things. They're tracking behavior. If the eyes look aligned, those are simple things you can watch for at home. And I just want to close with, most importantly, just trust your instincts. You're the parents. We see your baby for an hour. I mean, the part that I'm in the exam room, maybe 15 minutes, because most of the time the baby's eyes are dilating. I'm not with them the whole time. trust your instincts. Make sure if you really feel like, no, most of the time the eyes look like this, take photographs, show your doctor when you come in. No doctor is going to feel upset when you come with questions or feel really armed to be able to engage meaningfully in these discussions and the treatments for your kids. So always trust your instincts and know that we're all a team and we are really trying to just help make sure that your baby is maturing the way that they should. Well, that's it for today's episode. Thank you so much for joining me for In Focus. If you've got questions or you have stories or you would like something answered on a future episode, make sure to DM us on Instagram or send us an email at hello@drrupawong.com. Until next time, I'll see you later. Bye-bye. Thanks for joining me on In Focus. If you found today's episode helpful, I'd love for you to share it with a friend, leave a review, or hit that subscribe button so you never miss an episode. For more tips on eye health, parenting, and staying focused in a busy world, follow me on Instagram at Dr. Rupa Wong or head to drrupawong.com. Until next time, keep your vision clear, your priorities focused, and your family thriving.